What does it actually mean when prostate cancer becomes metastatic? Most men who are asking this question immediately come to the conclusion, this is the end. The heavy curtain falls. But here's the reality. That assumption is often wrong. And in some cases, it can be dangerously wrong. Because metastatic prostate cancer today does not behave the way most people imagine. Let's strip it down to the basics. The prostate is a little gland underneath the bladder. Think of it as a small, quiet room. Prostate cancer can stay locked inside this room for years, behaving itself. But the metastatic process begins when the cancer cells learn one dangerous trick. How to pick the lock and leave the prostate. They escape through two main exit routes: the bloodstream and the lymphatic drainage system. Think of these as the body's superhighways. The tumor is not just a simple lump anymore. It becomes a systemic disease. It wants to travel from its origin and set up new colonies. But here is the key point most people don't fully understand, even if it spreads to the liver. It is still prostate cancer. It is not liver cancer. That really matters because our treatments still target the biology of the prostate cancer. No matter where it hides in the body, it keeps its original cellular identity. At diagnosis, roughly 5 to 10% of men already have metastatic prostate cancer. And a significant proportion will develop it later. But prostate cancer doesn't just spread randomly. It has favorite vacation spots. One of the first sites of spread we see are the lymph nodes. These nodes act like security filters trying to catch the escaped cancer cells. If the cancer cell colony starts to grow, the lymph node enlarges, ringing the alarm bell. But its second and most favorite preference is the bone. Places like your pelvis, your ribs, or your spine. Why the bone? Because of a fascinating biological concept called the seed and soil effect. The prostate cancer cell is the seed, and your bone is the perfect, nutrient-rich soil for that seed. Once it gets there, it doesn't just sit quietly in the dark. It actively changes how your bone works.
Push harder, you scrubs! Yes, look at it crumble!
Around 80 to 90% of men with metastatic prostate cancer develop bone metastases. This is why bone-related symptoms are so central to understanding this disease. The bone is rich in growth factors, little signaling molecules that cancer cells can actually use as building blocks. Prostate cancer cells are especially adapted to recognize this environment. Once they arrive, they start communicating with your bone cells.
Exactly. Don't worry about the structural integrity. It'll be fine.
That twisted interaction is what allows the metastases to grow. You see, healthy bone is constantly rebuilding itself. Old bone breaks down, and new bone is created. It's a perfect, elegant balance. But metastatic prostate cancer destroys that balance. It acts like a terrible project manager.
Please, we're trying. It hurts.
Forcing the bone to grow, but in a chaotic, weak, and rushed way. These are what doctors call osteoblastic metastases. The cancer stimulates new bone formation. But this new bone is disorganized. It's fragile. It's like building a brick wall without any mortar. So, even though X-ray scans might show more bone, that bone is actually weaker. and much more likely to break under everyday stress. This is exactly why the pain happens, and this is why fractures happen. However, not every bone metastasis leads to a fracture. The risk depends on the location, the size, and how much of the bone structure is involved. Lesions in weight-bearing bones, like your spine or your femur, are the ones we watch most carefully. This thick, chaotic bone growth causes increasing bone pain. Often the very first warning sign that the cancer has moved. Men often come into the clinic complaining of a deep, increasing ache in their lower back or pelvis. But there is another hidden layer to this. Inside your bones lies the bone marrow. The factory that produces your blood cells, including white cells, red cells, and platelets. When extensive bone metastases occur, this vital factory gets compressed by the chaotic new bone growth. The assembly lines slow down. One of the primary signs many men experience is a lower level of hemoglobin. The protein in red blood cells that carries oxygen. When your oxygen delivery drops, you don't just feel a little sleepy. You become profoundly tired. You experience severe fatigue and exhaustion that a cup of coffee simply cannot fix. Many men blame themselves, thinking, "I'm just getting older." But this isn't just getting older. This is how the biology of the cancer is actively changing the internal mechanics of your body. The seed has disrupted the soil, and the soil is struggling to support the factory. So, when metastatic lesions appear on a scan, everything in the body changes. But here is the most crucial part.
That you
Our
remember
goal
to
as
take your
doctors changes,
medication
too.
exactly as prescribed every day.
We are officially shifting from curing the cancer to controlling the cancer. I want to make this
understand
exceptionally
difficult
clear.
news to hear. Please know that my team and I are here to support you every step of the way.
Because hearing the words metastatic prostate cancer can be paralyzing. This is not the end of your life. This is simply a change in the approach to how we manage the disease. Here is the modern medical truth. We no longer handle this like an immediate, deadly threat. We are handling it more like a chronic illness. Think about conditions like high blood pressure or type 2 diabetes. You don't cure diabetes, you manage it effectively over a lifetime. We are managing metastatic prostate cancer over time, and thanks to science, we are doing it with incredible success. We don't just attack the cancer blindly anymore. We use a highly calculated, multi-layered defense strategy to protect your quality of life. And importantly, we don't just treat the cancer itself. We actively protect the soil. We protect your bones. We use specific medications, like bisphosphonates or denosumab. Think of these as reinforced steel beams for your skeleton. They help slow down the chaotic bone damage. Clear out the bad construction and significantly reduce the risk of fractures. In some cases, the bone can even partially stabilize and heal again. So, this journey is not just a one-way process of decline. It is an environment that can actively influence, modify, and strengthen. We can relieve the compression on the marrow. We can ease the bone pain. We use targeted radiation to soothe specific painful spots. Before a fracture ever has the chance to happen. We are no longer passive observers of this disease. We are active managers of your body's ecosystem.
Some strong bones. Are you ready? Yes, doctor.
Ensuring that the structural integrity of your bones is preserved for as long as possible. But what does this really mean for your daily life? Most men will be on treatment long term. The absolute backbone of this treatment is hormonal therapy. Why? Because testosterone for prostate cancer cells
Let's party!
is exactly like pouring high-octane gas onto a fire. Our goal is to lower the testosterone to starve the cancer cells, slowing their growth to a crawl. Of course, turning off that fuel supply comes with trade-offs. You might experience lower libido, some weight gain, or hot flashes. It is a biological negotiation.
Yes, doctor. I feel much better about the side effects now.
Later on, if the cancer adapts. We have next-generation pills, targeted systemic treatments, and eventually chemotherapy to keep the disease cornered. But here is what matters most. The goal of modern oncology is not just to extend the length of your life. The goal is to extend the best life you can possibly have. Living pain-free, playing with your grandchildren. Enjoying dinners with your family, maintaining your dignity and your joy. This is where the landscape of modern oncology has changed dramatically. Let me leave you with something profoundly important.
With the right care, we can achieve remarkable things.
Historically, a few decades ago, the median survival for this stage was around 2 to 3 years. Today, with modern therapies, the script has been entirely flipped. Many men live significantly longer, often 5, 10, or even 20 years, depending on how their specific disease responds. Having metastatic prostate cancer used to mean living on a very short timer. Today, men are not just existing. They are functioning, traveling, and thriving. Every cancer behaves differently. Some are aggressive, yes, but many grow very slowly. If you take one thing away from this video, let it be this.
This is the most important takeaway message.
Metastatic prostate cancer does not mean immediate death. It simply means a different phase of the disease. A serious one, but one we understand vastly better today than ever before. The information in this video is for reference only and does not replace professional medical advice. Please consult a doctor before applying any changes to your health.